You have been referred to the East Lancashire Tongue Tie Service for Infants. Here, we assess babies who have had feeding problems, despite intensive input from feeding specialists. You can be referred by your health visitor, midwife, GP, or other healthcare professional. The service deals with babies, usually less than 3 months old. Sometimes, we treat babies up to 6 months old. We don't assess babies for future speech problems. The service is mainly for breastfed babies, but we also assess babies struggling with bottle feeding. Everyone has a tongue tie. It is a normal structure of fibrous tissue between the underside of the tongue and the floor of the mouth. What varies is how tight or restrictive it is. In some babies, the tongue tie is restrictive. It stops the tongue moving properly. This can cause feeding difficulties. When you are seen in clinic, the doctor will ask questions about your baby's feeding on the breast and on the bottle. Your baby will then be held by a nurse or member of staff to be examined by the doctor. If the tongue tie has to be cut, it will be done immediately. No local anesthetic is applied. This is a very brief procedure. Sometimes the babies even sleep through it. Although the procedure causes anxiety in parents, it is usually something the babies deal with. It is often over and done with uneventfully and very quickly. As a team, we have released approximately 5,000 tongue ties over 14 years. None of the babies have yet had an infection. There is always some bleeding at the site of the cut. Rarely, there is more bleeding than expected. This is approximately 1 in every 700 babies, or once every 2 years. Afterward, the tongue tie is cut. The baby tends to sleep or feed. There is no specific aftercare required. The purpose of this video is to inform you of the consultation and encourage you to think about any questions you might want to ask.